Okay, let's talk concussions and head trauma. So, the human design was not made to withstand the impacts that we're being exposed to on the day to day now. So, we got car wrecks, we have football injuries, we have all kinds of head injuries, and the design was just not simply caught up to that. So, the human design is almost perfect. However, when our brain was doubling in size over the past few million years, the upper neck did not have enough time to catch up. So there is a workaround for this. You can strengthen the neck musculature to help prevent whiplash-like injuries and concussion. However, most people are not doing that, and that's why now in the NFL, one of the biggest things they're doing to help prevent concussions is actually strengthening the neck. Same reason why woodpeckers don't get concussed when they're banging their head on some metal pole or on a tree, and it's because their neck is so much stronger than other animals. With us, the weight of our skull is about as much as a bowling ball, and the C1 bone, which that skull sits on, is only about 6 grams. So we're talking a huge weight difference. So that's why the C1 bone is called Atlas, because it's the small man that has to hold up the weight of the earth, otherwise your skull. So when we are exposed to a concussion, which a lot of people have the mechanism of action of a concussion a little bit confused. So many people think you hit your head and then your brain hits the inside of your skull, and the impact is what causes the concussion, and that's the problem. Where in reality, the actual mechanism of injury is a little bit more complicated than that. When you sustain a impact at high speed or a whiplash-like scenario, what's really happening is the fluid within the skull, the cerebral spinal fluid, is protecting the brain so it doesn't impact the inside of the skull. It's very similar to where if you put an egg in a mason jar, fill that mason jar to the brim with water, which that environment's very similar to how the skull and the brain are situated. It is almost impossible to break that egg when you do that with simple fluid dynamic physics. Try it sometime. Try to break an egg inside of a full mason jar. The water, the way it moves, protects the egg, almost like the human design thought of this. However, what the human design was not ready for was these sort of whiplash injuries. Whenever you have a head injury, the amount of G's of force on the upper neck is about 90 G's of force. Just to put that in perspective, really bad car accidents have been at about 45 G's of force. So what's really going on is there is shearing of the connective tissue that surrounds the brainstem and the spinal cord that occurs when you have these extreme whiplash scenarios. And then that shear force, so the connective tissue of that brainstem as it comes through the top bone of the neck and into the skull at the craniocervical junction, when there is a big impact, that shear force actually will rip some of the surface axons off the brain. That is the concussion. It's not the impact of the skull. It's really a brainstem related problem, which if you look at all the concussion protocol testing, you always see people looking at people's eyes, looking at how their pupils move. Every sideline concussion test or any concussion test that a lot of neurologists will do are all cranial nerve exams. And the cranial nerves all come out of the brainstem. They don't come out of the higher cortexes, which what they think is what's impacting the skull. It's all coming from the brainstem because it's a brainstem problem. So now that we know what the root of the concussion protocol is, the root of the concussion problem is a brainstem issue, now we can actually take steps to help heal a concussion once it's already happened. So before a concussion happens, strengthening the neck is going to help protect that whiplash scenario from occurring, or at least it's going to protect it from being as bad as it can be. However, when you're looking at healing it once it's already happened, most of the time neurologists, they can't do an MRI because MRI is not going to show anything. They could do a CT scan, but that's only really going to show if there's a brain bleed, which is only going to happen in really intense, extreme scenarios. So most of the time, they'll just do a few tests, and they're like, sit out for 2 weeks, rest, and you'll probably be fine. If you have any headaches, you might just have to live with that. And a lot of people will have lingering concussion syndromes. It's called post-concussion syndrome. It's a real thing for years and years after. And then sometimes it can develop into some things like CTE, which is where the brain tissue actually starts to pull in, which is most likely actually from a cerebral spinal fluid ability to drain, but I'm starting to go down a rabbit hole here. So going to heal from a concussion, you want to look to see where the tension around the brainstem is from the accident or the injury, and then release that pressure, take the tension off the brainstem. So now the fluid of the arteries and the veins that surround the brainstem can actually flow again. And that's what's going to pull fresh blood up into the brainstem, up into the base of the skull, and then drain that cerebral spinal fluid and drainage out of the skull, which is what's the most important. Some people feel like they have this pressure in their head. It's because there is pressure, and that fluid can't drain out because of all the inflammation and the pressure that's going on in the upper neck, right where the craniocervical junction of the skull and the first cervical vertebra are. So once you go about fixing that and taking the pressure off that, usually the actual healing time is much quicker, and you prevent post-concussion syndrome later on. If you already have post-concussion syndrome, then it's even more important to come in and get this corrected so this doesn't keep lingering into future issues, because usually it just doesn't get better on its own. Now, the best way to manage a concussion scenario is to have anybody who, especially athletes who are going to be more likely to be supposed or exposed to these head injuries, is to do this eye-based exam. In Vital Balance, we have the right eye system, which is an infrared tracking system that takes 90 images of your eyes per second. And as your eyes track these objects moving around the screen, it's going to see how the pupils are dilating and how they're converging to that point. And then it'll score you. And then if you have an injury to the head later on, the most accurate way to tell if you actually had a sustained injury of the brain or the brain stem is to then go and do that same test afterwards and compare the result. And if your score is 10 points lower, then we know you had some serious injury going on. And then we know exactly when you're healed enough to return back to the field or return back to living more of a dynamic lifestyle when that score goes back to where you were. Otherwise, we have really nothing to compare you to, and we will see improvement over time in that score. But that's the best way to manage a concussion or head injury scenario. So at Vital Balance, that's what we do. We do that eye scan. We take 3-dimensional x-rays of the upper neck to see where the pressure is around the brainstem. Then we use a technique called orthospinology to gently put that bone back in place and release the tension around those arteries so the brain can actually heal again. So that's what we do at Vital Balance. And it is really important, if you're having post-concussion syndrome, to come in as soon as possible and to get that looked at.